Hey all, today we are going to see key strategies to prevent phlebitis, infiltration and extravasation. Phlebitis is inflammation of a vein often associated with peripheral venous catheters. Clinically, it may present as pain, redness, swelling, warmth and a palpable cord along the vein. Let's see the difference between infiltration and extravasation. Infiltration is the accidental leakage of non-vesicant IV fluid or medication into the surrounding tissue instead of the vein. Extravasation is the leakage of a vesicant or irritant drug from a vein into the surrounding tissues, causing pain, swelling and possible tissue damage. Here are some risk factors. Mechanical causes: catheter motion, poor stabilization, large catheter size, repeated manipulations. Chemical causes: infusion of irritating or hyperosmolar solution, pH extreme, incompatible drugs. Infectious causes: bacterial contamination at insertion or via connections. Patient-related factors also play a role. Fragile veins, extremes of body mass index, comorbidities, dehydration. Research shows that in underweight or overweight patient, use of large gauge catheters increase risk of phlebitis. Causes of phlebitis: patient-related factors. Age: elderly and very young patient may have fragile veins. Poor nutritional status, that is, low protein vitamin deficiency. Previous history of phlebitis or thrombophlebitis. Medical conditions such as diabetes, immunosuppression, coagulation disorder. Obesity. Veins hard to locate. Children or restless patient may have more movements. Vein site related factors: small, fragile or hard to see veins, veins near joints which have more movements, poor vein selection, tortuous or sclerosed vein. Veins near joints, more movement, more irritation, previous phlebitis or thrombosis in the same vein. Cannula device related factors: using a large cannula in a small vein, cannula left in a place too long over 72 to 96 hours, poorly secured cannula. Damaged or defective cannula, poor quality or rough edges on the cannula, multiple attempts or repeated manipulation during insertion. Infusion medication related factors: irritant or vesicant drugs, hypertonic or irritant solution, example, potassium chloride, antibiotics, chemotherapy, hyperosmolar glucose, blood products and parenteral nutrition. High flow rates, cold fluids, multiple drugs given through the same line. Here are some signs and symptoms: redness at the site, swelling, pain or tenderness, warmth over the vein, palpable cord, that is hardened vein, fever in severe cases. Preventive strategies for phlebitis: vein selection. Choose a healthy large vein, preferably in the forearm or hand. Use distal veins first, then proximal if needed. Do not put an IV in a joint area like the wrist or elbow because movement can damage the vein and cause phlebitis. Cannula selection. Use the smallest suitable cannula for the chosen vein. Select the cannula carefully. Securing the cannula. Fix the cannula firmly using a transparent dressing. Use a splint if the cannula is near a joint to prevent movement. Inspect the site frequently for redness, swelling, pain or warmth. Flush the cannula regularly to maintain patency if not in continuous use. Replace IV sets according to policy, usually every 72 hours. Administer at the correct rate to prevent vein irritation. Do not give irritant medication in continuous IV infusion without proper dilution, as this can irritate the vein. Visual infusion phlebitis score. IV site appears healthy, score 0, no sign of phlebitis, observe cannula. Slight pain at IV site, redness near IV site, score 1, possible sign of phlebitis, observe cannula. Pain, erythema, swelling, score 2, early stage of phlebitis, resite the cannula. Pain along the path of cannula, erythema, induration, score 3, medium stage of phlebitis, resite the cannula, consider treatment. Pain along the path of the cannula, erythema, induration, palpable venous cord, score 4, advanced stage of phlebitis or start of thrombophlebitis, resite the cannula, consider treatment. Pain along the path of the cannula, erythema, induration, palpable venous cord, pyrexia, score 5, advanced stage of thrombophlebitis, initiate treatment, resite the cannula. Drug and fluid administration. Check compatibility of all drugs before giving through the same IV line. Flush the IV line before and after each drug to prevent interaction and blockage. Drug and fluid administration. In shock, use a large vein and large bore cannula for rapid fluids, but remove it soon after to prevent phlebitis. Isotonic solutions are 0.9% sodium chloride, lactated Ringer's solution, 5% dextrose in water. Hypotonic solutions are 0.45% sodium chloride, 0.33% sodium chloride, 0.2% sodium chloride, 2.5% dextrose water. Hypertonic solutions are 3% sodium chloride, 5% sodium chloride, 3% sodium chloride or 5% sodium chloride plus dextrose in water. More than 5% dextrose in water, example, dextrose 10% water. IV care, infection prevention. Hand hygiene. Wash hands with soap and water. Use clean gloves for insertion. Skin antisepsis. Do not touch the needle or catheter tip. Clean the skin with chlorhexidine, alcohol for 30 seconds. IV hub and port care. Scrub the hub for 15 to 30 seconds before each access. Ensure it is completely dry. Do not keep the IV hub open after use because germs can easily enter through an open IV port. Use disinfecting caps if available. Closed IV system. Use a closed extension set to prevent contamination. Tighten all connections to prevent leakage and entry of microorganisms. Avoid frequent line disconnection. Dressing care. Use sterile, transparent dressings. Keep the site visible through the dressing. Date and label the dressing. Change dressing if wet, loose or soiled. Catheter site assessment. Check every 1 to 2 hours for redness, swelling, pain or tenderness, warmth, leakage, hardness. Report and remove IV if sign of infection or infiltration are present. Patient education. Teach patient to report pain, burning or swelling at IV sites. Encourage mobility and hydration at home if they have peripheral IVs or PICC lines. Thank you.